my sad story. I'm shot in the chest and I know I must die.
Well, so how is Chick-fil-A for lunch? Good? Okay, good. We have plenty, so if you do find yourself needing some more, we absolutely have plenty. So, and then we have afternoon snacks, so we want to make sure and keep you well fed and well hydrated today. And we're halfway through. How are we doing? Everybody doing okay? This is just a beautiful location and fantastic speakers, and we have a whole full afternoon to go as well. So what we thought we would do while you guys please enjoy lunch, we're going to take a few minutes to give you some information on resources. So first I'm going to introduce Belinda Benavidez, who I have the incredible, I'm just so incredibly privileged to get to work with Belinda every day at the Alzheimer's Association. She has worked at the organization for about over 6 years. She spent 4 years on programs and helping with education and training while I was in development, and now we've swapped. Now Belinda is our development director, and I'm over on programs and advocacy now. Belinda has, she just does an incredible job and has her Master of Arts from Incarnate Word in San Antonio. And so she's going to go over, just briefly while you guys enjoy lunch, some more specifics about the programs and services available through the Alzheimer's Association. And then we are very fortunate to have Iris Gutierrez, who is here from the Area Agency on Aging, otherwise known as AAA. Not the car one, but the aging AAA. And she is going to go through some of the local resources that you may not know about either. Iris has been with AAA for 8 years, has over 15 years of experience in the field of social services. She is a certified CHIP counselor, certified ombudsman, does case management, care coordination, a little bit of everything. And so I'll have Belinda and Iris come up and share some resources.
Thank you, everyone, and again, thank you for spending your day with us. We're super ecstatic and feel so great by all of you who have dedicated your Friday and spent time to learn more about Alzheimer's disease and really empower those around you to learn more about this disease and all about the symptoms and the tips and techniques we learned this morning and all of the different resources we're going to learn about this afternoon. Like Jenny said, my name is Belinda Benavidez. I work for the Alzheimer's Association. Call on us anytime. I don't know if you know this, but the Alzheimer's Association is a national nonprofit organization. We are in over 70 different chapters across the U.S., including the territories. So we have friends in Hawaii, lucky them, right? Have an Alzheimer's Association office in Hawaii. But yes, you can visit anywhere in the U.S. and you'll find a person who can help you, who works for the Alzheimer's Association. And we have a lot of information, very reliable information about Alzheimer's disease. A lot of it is about building your knowledge, finding out what those symptoms are and those 10 warning signs, learning about Alzheimer's and the education that comes along with it. We have referrals and support groups for millions of people. Where's Melissa Guerra? Melissa is our local support group facilitator. So if any of you, yes, thank you. If any of you are looking for resources or for outreach and want to talk about what you and your family are experiencing, visit Melissa's support group. It is 100% confidential, and you can share what you're feeling, what you're going through, what happened to you in the last month. And it's a wonderful opportunity to meet other people who are going through the same thing you're going through or who have already gone through it and can offer you some fantastic advice. We are a nationwide network of people who help families and friends and healthcare professionals to learn more about Alzheimer's disease. We have a 24/7 helpline. They speak up to 140 different languages at this helpline. So if you have someone who only speaks Spanish, you can call this helpline and they will have a Spanish-speaking person help you with whatever you need. And they will also provide you with the resources and with the events like this one that are happening in your community to help you get connected with other people who are learning about Alzheimer's disease. You can also visit our website. There are several slides sliding through here, and if you visit ALZ.org, it is a award-winning website that tells you all about Alzheimer's disease. You can talk to other people. There's something called ALZ Connected, where you can connect with other caregivers in the U.S., maybe even the world, because it is the internet, it's open to everybody. So you can connect with other caregivers, talk to them about what you're doing. We have a toll-free support group line. So if you can't make Melissa's support group meeting, you want to call this number. You cannot leave your house. The other day I met a woman who hadn't left her house in 3 months because she was taking care of her husband. You can call us and we will connect you with our telephone support group. So you don't have to leave your home, but if you want to, you have that option to get on the phone or go visit a support group in person. Another thing that ALZ.org offers is safety tips. A lot of people are living at home and they start thinking about what to do. I know you mentioned earlier about getting locks for your home. You know, there's a lot of different safety tips that happen around the home, and you can find all that through ALZ.org. You can also talk to people on ALZ.org about driving tips. Should my loved ones stop driving? Is it safe for them to keep driving? You know, when is it time for them to not live alone? You can have those conversations on ALZ.org with people all over who have some fantastic advice to give and give you those tips about Alzheimer's disease. Another thing that you can do is visit the Alzheimer's Association Navigator, and it's alzheimersnavigator.org, and it's an online assessment program that creates customized action plans and works in conjunction with the Alzheimer's Association community. It's a great place to find resources, locating community programs, services and resources. It's a great resource, and that is alzheimersnavigator.org if you want to look it up online. We also host a series of educational workshops and presentations throughout the year. We travel throughout South Texas. Our office in San Antonio covers over 48 different counties. And so we are there to provide support and education for all of those counties, including Webb County, which is where Laredo is. So you can call us, you can talk to us, you can request presentations. We can see if maybe a local volunteer can do a presentation. If not, maybe a staff member can come down to do this. Now, we are a nonprofit, so we have to have funding to travel. So it's always an option. You can just call us, and maybe we do have a local grant or something that we can make the trip to Laredo. Or maybe we can do a web conference where we're, I don't want to say teleported, because it's not teleporting. I don't know what it is. It's a web conference. So you can do all kinds of options. We can do conference calls. One of the wonderful things about the 800 number, which is a fantastic resource, is you can put people on the speakerphone in the middle of the family table and have your family members around the table. That works for the telephone support group. That also works for our helplines. So if you have a question about Alzheimer's and your family is not on the same page, like there's one person who is thinking your mom shouldn't be driving, the other sister is thinking it's okay for her to drive, it's just dementia or it's just Alzheimer's, and you know what's right and wrong, you're having that conflict, you can call the Alzheimer's Association 24/7 helpline anytime, 24 hours a day, and you can say, you know, we have a question for you and we'd like to know an official response. You can talk to someone at our helpline. And the person on the other end of the line, just so you know, is a licensed social worker. You're not going to get somebody who is not licensed. You're going to be able to talk to them. Some of them do hold their master's degree in social work, so you will be able to communicate with them, ask them questions. They'll be very familiar with everything that happens when a family goes through the journey of Alzheimer's disease. Just know that the Alzheimer's Association is there. We're a great resource for you. Please call us. Do not hesitate. Don't let language be a barrier. Remember, all of us can help you provide, get you connected with that translator if they are only Spanish speaking, or maybe it's only French speaking, or Chinese, or there's a specific language. Don't let that bother you. If you have a friend that is hesitant about calling us, it's a free phone call. We do not charge. We're a nonprofit. We're here for you. So give us a call anytime you want. Again, my name is Belinda. Do any of you have questions about the Alzheimer's Association? Yes.
It may sound silly, but Alzheimer's, all nationalities get Alzheimer's. Is there?
Oh, that's a good question. The question is, Alzheimer's, do all nationalities get Alzheimer's? The official response is, Alzheimer's does not discriminate race. It does not discriminate on household income. It doesn't discriminate on level of education. You could be a rocket scientist and still get Alzheimer's disease. It all has to do with your lifestyle. Now, the numbers are higher depending on your lifestyle, meaning if you have diabetes, you have a higher percentage chance of developing Alzheimer's disease. If you have stroke or hypertension, all of that is increasing your chances of developing Alzheimer's disease. Now, you could be totally healthy and still get Alzheimer's disease. You could be the picture of health. And that's one of the reasons why we have big walks called Walk to End Alzheimer's. And this walk, portions of the donations that go towards that walk go towards research to help find out what causes Alzheimer's disease. What is it that triggers in certain people and not other people? What is it that happens? Because it doesn't discriminate as for race. Now, in being Hispanic, we have more diabetes in our culture. We love those flour tortillas and all of that rich food and spices and everything. Yes, and the tamales. And so we are more inclined to develop Alzheimer's disease because of our diet. Now, when you're thinking, okay, well, who else gets Alzheimer's disease? African Americans, because of their diet as well. And another thing is we have different cultures that really play into our lifestyle. So remember, when you want to stay brain healthy, you just, whatever's good for your heart is going to be good for your brain. So that's how you stay brain fit. So that's what we want to promote. More questions? More active, that's right. Any other questions? Okay, I'm going to pass the mic over, and we're going to talk more about your local resources. Thank you.
Okay, can you all hear me? Good afternoon. I'm here to talk to you about our agency, the Area Agency on Aging of the South Texas Development Council, whose goal is to promote the improvement and the quality of life for our region's older population. We strive to ensure continuity of care while allowing our older population to remain in their own homes, thus maintaining independence, dignity, respect, and preventing institutionalization. Excuse me if I keep smearing my throat, I have allergy. The Area Agency on Aging of the South Texas Development Council is one of 28 area agencies on aging across the state of Texas. We plan, coordinate, and administer comprehensive services authorized by the Older Americans Act and the Texas Department of Aging and Disability Services for residents of West, Jim Hogg, Starr, and Zapata counties who are over the age of 60 or are caregivers of individuals age 60 and caring for a grandparent caring for a child 18 years of age or younger. Now, the Area Agency on Aging provides services to the direct service to a 60-year-old beneficiary and caregiver support services for a person caring for somebody over the age of 60. Within those services, we provide home modifications, which can include ramps, grab bars, accessibility into the showers, into the home. We've done a lot of residential repairs, also in-home provider services, which also go directly to a beneficiary 60 years of age or older, or for somebody like a caregiver caring for somebody over the age of 60. The calls come in at first. We have an information referral and assistance program. That's where our intakes come in, and that's where we receive the calls. We either divert them to other resource agencies, or we take the intake and put them on our interest list for consideration of services. Or we provide information to people seeking information about, for example, like the Alzheimer's Association. We also provide benefits counseling. The benefits counseling is a free service to assist anyone who is age 60 or older with obtaining information regarding public benefits, private benefits, and a variety of community support programs. Benefits counselors can provide information, counseling, assistance, and advocacy to older persons and others who are Medicare eligible regarding their benefits, entitlements, and legal rights. I'm skimming through, I'm not even moving the PowerPoint. I was going to show you some pictures that we have of some of the modifications that we've done. Oh my goodness, it's going to take long. I know there's probably a bunch of caregivers in the room. With our agency, under the Caregiver Support Program, we do provide respite care services, and it's only a temporary service, it's usually about a month, and this is to help the caregiver have some time to themselves, rest, and also we provide assistance or information for these caregivers to assist them better in the community with their loved ones. The Area Agency on Aging also has senior centers or nutrition sites within the 4 counties that we service. And these are places that elderlies go and have a meal or like recreational or socialization interactions. We also provide transportation under the border area nutrition, known as BANK. However, these services of transportation are only limited to the persons participating in the congregate sites. Is there a way that this could go faster?
To go faster, you're already setting a record.
Photos that we have of some of the residential repairs that we've done. We've done complete bathroom modifications for accessibility. So y'all might be wondering probably how would you qualify? You have to be 60 years of age or older to qualify for a direct service. That would include in-home provider care services, health maintenance services, residential repair. However, for caregiver respite support services, the care recipient has to be 60 years of age or older, but the caregiver can be below 60 years of age or older. You have to reside within the 4 counties of our agencies, which is Jim Hogg, Zapata, Starr counties, and of course Webb. The service availability is determined by the region's needs of older persons who reside within the service area, the level of funding available to support these services, and the availability of providers to deliver these services. All persons age 60 and older are eligible under the Older Americans Act programs. When program resources are limited, priority is given to those in the greatest economic and social need. However, no income checks is required. Voluntary contributions, of course, are encouraged to expand our costs and benefits, and to expand our benefits. Y'all have any questions?
I was gonna say, like, for instance, like my mother, that she needs to go to the doctor once in a while, but she needs a lift to pick her up and take her to the doctor and bring her back. They don't have that service.
They have the Metro lift. You just have to apply through the Metro, and then you would need to kind of tell them ahead in advance when you have an appointment, and they'll pick you up. And they have a lift. Now, medical transportation is a little different. You need to get a prescription from a doctor. You have to have medical necessity. There's other ones that aren't, like ambulance transportation, that might be covered, but sometimes there's a cost. And it's just like the floor, it's a van. Any other questions? These are some of the photos from our nutrition sites and from our home delivered meals. We also provide home delivered meals. The one that has kept our office really busy is the legal assistance and benefits counseling, which we provide benefits counseling to persons who receive Medicare benefits. And we have a lot of people coming into our office because of all the plan changes that have started, the prescription drug plans, all health plan options, Star Plus. So we receive a lot of calls for assistance with that program. We also have the Ombudsman program. An ombudsman is a certified local nursing home advocate, and an ombudsman provides information to residents and families about resident rights and to help identify additional resources in or out of the facility. An ombudsman identifies, investigates, and resolves complaints by or on behalf of nursing home and assisted living facility residents, and work with residents, families, and friends, and facility staff to improve the quality of the residents' life. I'm going to go to the slide with our contact information. So if y'all have any questions, feel free to call our office. We can either provide you with information, or we place you on our interest list for consideration, or we can mail you out information about the information that we have. Any other questions? Yes?
Iris, you have a table out in the exhibit hall, right? So
Yes.
you can get your phone number off of
They
that?
sure can.
Okay.
But if somebody misses that, they can always call our office, because sometimes maybe they want to talk to us privately, one-on-one.
Yeah.
So they can call our office, and you don't always have to come to our office. We also do home visits. If somebody is homebound and they're not able to get them out of the home to come to our office, we will do home visits. We also go to the senior sites and provide outreach to our nutrition centers. There's some that are in here that I've helped before. Any other questions? I'm done.
Okay, thank you so much, Belinda and Iris. We very much want to thank you for bringing these services to our attention. And it's one of those things where you just never know when, and if you don't need it now, you might in the future. So thanks.
Or you might know somebody.
We want to say thank you.
Thank
And
you.
that is a beautiful painting from someone who had Alzheimer's disease. So thanks, we really appreciate it. And thanks, Belinda. And so we're sort of on lunch break time. We have on the schedule to start back up at 1:30. And I'm sure Joe wouldn't mind if we started a few minutes early, possibly. But please take a break and visit the tables. And we do have plenty more chicken sandwiches. If anyone wants seconds, please. We have plenty.
wrapped up in white linen.